A new report from Toronto's Medical Officer of Health on the impact of COVID on kids was submitted to the Board of Health today. Dr. Eileen de Villa's report says children faced a wide range of indirect physical and mental health outcomes linked to the pandemic that warrant further investigation. Her report cites disruptions to in-person learning and their impact on mental health, substance use, nutrition, physical activity, dental health, and access to other vaccinations. To discuss, we're joined live tonight by Dr. Dina Kulik, pediatrician and founder of Kid Crew, Tracy Vinecourt, Canada Research Chair in School-Based Mental Health at the University of Ottawa, and Todd Cunningham, applied psychology professor at the Ontario Institute for Studies in Education. Thank you all for taking the time to be with us on CP24 tonight. Dr. Kulik, before we dive into this report, because there really is so much to talk about, I want to start by talking to you about what we heard from the province's top doctor today. Kieran Moore saying mask mandates are not coming back to the classroom. What did you make of that? Is this something you wanted to see?
I'm disappointed for sure. Kids are getting COVID in droves, so are their family members and loved ones. We're seeing huge school absences, both from students and teachers and administrators. Kids are getting COVID at an alarming rate, and unfortunately, more kids getting COVID means more kids getting very sick with COVID, more kids getting hospitalized with COVID, and potentially even worse. So I would love to see masking back in schools.
He also said, Dr. Kulik, that there's no significant rise in ICU, in children in ICU. He noted that there are currently only 2 children in ICU with the virus. And for that reason, we don't really need to bring these masks back into schools. What did you make of that argument?
We do know that hospitalizations and kids and adults getting very sick with COVID is a lagging indicator. It's not the first thing that happens. First, we see a rise in cases, and then we start seeing people need hospitalization and, more intensive support. So hopefully we don't see kids getting more sick or needing hospitalization, but that alone isn't reason for me to not do something public health-wise that we know works. Masking is not a huge burden. It's not expensive, it's not risky, and it is very, very effective at preventing illness. I don't see why we shouldn't bring it back.
Okay, I know a lot of doctors would agree with you tonight. I'm going to move on, though. Tracy, we'll come to you next. Let's talk about this new report because it takes a closer look at just how much this pandemic has hurt children, how it's impacted their mental health. What stood out to you?
Well, it was really interesting that they were talking about us examining this over time. We should have had the data before the pandemic so that we could make really meaningful comparisons and know where to put our resources. So that was pretty striking. And then the other thing is that they're actually going to be they're calling for programs to go in schools. And we've been long arguing for this. We've been long talking about the mental health crisis before the pandemic and how the pandemic exacerbated something that was already quite problematic before COVID-19 occurred. So I love their 2 recommendations.
Okay, Todd, no surprise, lockdowns, remote learning, school closures. I mean, it's been hard for children, right? And all of this has had an impact, a negative impact on children and youth. Talk to us about the long-term effects here.
Yeah, so one of the big things that we see is that first, not all students have been impacted equally. So we have a lot of students who have not had the same access to online learning or what we'd call emergency remote teaching because these students did not willingness necessarily participate in it, as well as their teachers didn't willingness have to deliver this way. So we have this impact in the loss of academic knowledge that has developed, as well as also with the mental health issues. We see higher rates of anxiety and depression. Our youth are feeling very lonely, disconnected from their social groups. And this is going to have a generational impact. And what we really need to do is, as we go back, is really to first assess, understand who are the students who have been impacted the most so that we can really target those resources to develop their academic skills and also address the mental health issues.
Generational impact. Wow. Dr. Kulik, what's also concerning here is that the pandemic created a backlog of public health dental screenings and immunizations at schools. That means thousands of students are missing some very important shots that they should have received months ago. How do we tackle the backlog?
I think first and foremost, people should touch base with their healthcare providers and find out what are they missing, where are they at, when was the last time the child was examined, when was the last time the child received vaccines, and what are they missing? And importantly, when did they see a dentist, when did they see an eye doctor? Because many families purposely avoided seeing healthcare practitioners during the the pandemic, of course. They wanted to avoid other sick kids. But in so doing, it's been more than 2 years now. Many kids are falling behind in the routine vaccines and examinations by their physician, but also those vaccines and dental visits and eye visits that they get in school-based settings as well.
Tracy, you're preparing to give a talk on how the pandemic has affected children's mental health tomorrow. You've really taken a very close look at this. Tell us what you've learned in the past 2 years and what you'd like parents to know tonight.
I want them to know that it's nuanced. We know that on average, children fared worse during the pandemic, and we would expect this. I mean, this isn't very comfortable. There's a lot of disruptions and the like. So this is to be expected. But there's also some kids who have done better during the pandemic, and we need to figure out why that is. So, for example, I study bullying. Bullying has been reduced by about 50% in Canada during the pandemic. This is a huge stressor for kids. So if we can improve our bullying rates, then maybe when everything's back to normal, we won't have this mental health crisis that we saw before the pandemic and that has continued during the pandemic. So those are just a few examples. And I also want them to know that it's not the same across the board for all disorders. So for example, we know that depression's a little bit higher than anxiety. Eating disorders are really bad during the pandemic. And then we've also seen some disruption in terms of externalizing problems like conduct problems and the like. So yeah, not everybody's doing badly or poorly, but a lot are.
Todd, a lot of parents might be watching this tonight feeling very anxious, very nervous about what this means for their child. What do you say to that parent? Can children bounce back from all that's happened in this pandemic, and how can they do that?
Yeah, kids are very resourceful and resilient. And so, yes, they can. But what's going to really take is it's more than just kind of our classroom teachers. It's really going to take a system approach to help identify those students who are at most at risk and who have fallen the furthest behind, really working with the school mental health leads, the school psychologists, social workers, and allied mental health practitioners to get in there to support the classroom teachers and those students to kind of get back on track, as well as also those academic skills to really identify those and fill those in. Because if we don't do that now, if we don't start planning now for the future, then yes, we're going to have a larger group of students who are not going to be able to engage in this type of learning that we want them to.
Okay, Todd Cunningham, Dr. Dina Kulik, and Tracy Vinecourt, thank you so much for this discussion. We appreciate you joining us tonight.